Hello everyone, this is the Mental Health for Life channel. Bipolar disorder is an illness that causes recurring bouts of mania, which is a mood elevation, and depression, which is a depressed mood. We call it bipolar because we see two poles of mood, mania and depression. It is the same meaning as manic depressive disorder. It used to be thought that manic depressive disorder and depression were the same disease, but about 20 years ago, it was discovered that they were two separate ailments. Therefore, in order to properly distinguish it from depression, manic depressive illness is now referred to as bipolar disorder. Bipolar disorder begins in some people with mania and in others with depression. Mania is simply a state of excessive energy. The mood is elevated, the person is active without sleeping, talks a lot, and spends a lot of money. However, they feel no pain and do not seek medical attention on their own. Depression, on the other hand, is a state of depressed mood and other symptoms of distress that trigger a visit to the hospital. Most people with bipolar disorder only complain of depression when they visit a doctor and do not tell the doctor that they had a manic episode as well. This causes doctors to diagnose depression without realizing that they have bipolar disorder. There is an optical topography test, but unfortunately it is not 100% reliable. This is how depression in bipolar disorder is initially diagnosed in more than half of patients. In the course of treatment, bipolar disorder becomes apparent when antidepressants do not work, or when the medications cause manic episodes. In fact, 20% of those initially diagnosed with depression later change their diagnosis to bipolar disorder. For some people, it can take several to 10 years before the correct diagnosis is made. Since bipolar disorder and depression are treated differently, it is preferable to distinguish between the two as early as possible. In this article, I will explain the characteristics of depression in bipolar disorder. I have listed 6 things that are particularly helpful in distinguishing it from depression. 1. Cyclothymic temperament. Cyclothymic temperament, also known as manic depressive temperament, is a personality trait that is often associated with bipolar disorder. Specific characteristics include a cheerful, sociable, talkative person who smiles a lot. In terms of appearance, many people are said to have round faces and are relatively plump. However, their mood tends to be influenced by their environment, as their mood rises when things are good and falls when things are bad. 2. Having a relative with bipolar disorder. Bipolar disorder is known to be strongly influenced by genetics. Data shows that half of people with bipolar disorder have a parent who also has the disorder. However, there is no single gene that causes the disease. It is a complex combination of genetic and environmental issues that lead to the onset of the illness. This does not mean that you shouldn't get married and have children, because the children of bipolar patients do not always develop the disease. 3. Some kind of neurological problem as a child. Bipolar disorder and schizophrenia are known to be caused by some kind of cranial nerve problem. This can lead to some developmental delay in childhood and neurological symptoms such as tic symptoms. If you have visited a pediatrician or psychiatrist for neurological symptoms around your middle school years, you should consider the possibility of bipolar disorder or schizophrenia if depression develops later in life. 4. Depression before the age of 25. Most cases of bipolar disorder develop in the teens or 20s. Unlike depression, not many people develop it after their 40s. Therefore, with regard to depression that develops before the age of 25, it is best to consider the possibility of bipolar disorder. 5. Overeating, oversleeping, and weight gain. Depression can cause symptoms of appetite and sleep. Many people with depression lose their appetite, have trouble sleeping, and lose weight. The word haggard is a perfect description of this state. In the depressed state of bipolar disorder, however, the patient's appetite increases and he or she overeats and often complains of fatigue, saying, "My body is as heavy as lead," and sleeps all the time. This tends to lead to weight gain. 6. Antidepressants do not work or work too well. People who take antidepressants with no effect at all or who improve rapidly are suspected of having bipolar disorder. If they do not respond at all, it is easy to diagnose bipolar disorder early, but if they are getting better, it is difficult to distinguish between the two. In the case of depression, it is normal for the patient to gradually improve with the help of antidepressants. But if the patient suddenly feels better and becomes active in a short period of time, as if the depression was not there at all, the possibility of bipolar disorder is high. This was the Mental Health for Life channel. If you liked this video, please give it a thumbs up and subscribe to our channel.